what we've tried to implement is more of a true service, that you see within the acute care setting where whether it's the general surgery team or the nephrology team, they're seeing a patient day after day after day, charting the progress, charting what they're looking for before the patient's ready to be medically stable, or in our case, to be released to the next level of care. But yes, having that devotion of resources is pretty unique for Mary Free Bed across the country. Having half-time or full-time consultants, even is pretty unique. There are, believe it or not, there are acute rehabs all over the country that take in patients just on chart review. A physician, reading through faxed papers or electronic medical records of a patient at some other hospital, and they bring the patient in, based on that decision-making process, which of course can work. But, when we are able to integrate into the acute care setting, we see it as so much more valuable, and we see it as something that builds, allows us to show our worth, as you said.
It's like a warm handoff, too,
You got it.
for the team here, too. There's like, okay, they've been thoroughly evaluated. I know this person who is admitting, and then we're going to bring him over.
Yeah, a lot of times I'll look at the papers, the notes, the progress notes, and then the patient comes, and patient doesn't always look like the paper. I mean, sometimes they look a lot better, sometimes they look worse. But to have that person on the other end with eyes on and being able to talk to the team to get what's really going on, which isn't necessarily in the chart, very helpful, again, in bringing the right patient at the right time.